I was experiencing an emotional roller coaster. I really didn't know what was going on, but I knew something had to change. When I went to my OBGYN, she pretty much knew that, yeah, from what I was experiencing, it was PMDD. She prescribed me a medication, but what I didn't know, which I wish I knew at this time, was that there's other approaches too.
We are pharmacists, so we know that there is a need for medications at certain times, and when it's necessary, it's necessary.
Yeah.
But what I loved also hearing is that there are these alternative options, holistic options, natural options, supplements, different forms of helping take care of your body and yourself and your hormones and just body regulation. Welcome, everyone, to the Patient Advocacy Initiative PI podcast. My name is Dr. Asha Pi Bohannon. I'm your host today, and I'm very excited about the guests that we have on our show. Dr. Ashley Fornes is a passionate advocate for women's wellness and hormonal health. She has a background in pharmacy and a very strong heart for holistic healing, which you know is part of my passion. She's on a mission to empower women in their journey towards balanced hormones and a vibrant well-being. Through personalized coaching, she helps women navigate the complexities of hormonal health, from PMDD to just everyday hormonal imbalances. Her goal for her clients is to really help them reclaim their vitality and thrive at every stage of life. I always love giving just a little bit of kind of what they like to do in their downtime or their hobbies. And something that she finds herself immersed in is scrapbooking projects, which is a girl after my own heart because I love scrapbooking. But she doesn't just find this as a hobby. It's actually her ultimate form of self-care. She gets lost in that creativity while preserving memories. And I think that's so exciting. So I'm really excited to have her here today to really dive into what does hormonal health look like at a younger stage. We typically talk about hormonal health as we get older when we talk about pre and perimenopause and then menopause and the change. So I'm excited to dive into that with her today. So welcome to the podcast, Dr. Ashley. So excited to have you here.
Thank you, Dr. Asha, for having me here, and I'm so excited to share my information.
What does hormonal health look like for women in their 20s and 30s? Nobody really thinks of it at a younger stage as much. And so I think that's really important. And I'd love to hear what that looks like for you.
Yeah, a lot of people don't focus on those that are in their 20s and 30s. Like, it's either menopause is a huge thing for people. Also, whenever girls start their period, in the teenage years, but nobody really focuses on those 20s and 30-year-olds. Yes. But what I found, which I wanted to focus on, is PMDD, which is funny because it's PMDD Awareness Month as well.
Oh, that's fantastic.
Yeah. But it all started kind of with my story with whenever I experienced PMDD myself. I was like in my early 20s, but I was experiencing just like an emotional roller coaster. I really didn't know what was going on. I had enough education to kind of research it and know what was going on, but I'm not one to really seek, medication. But I knew something had to change. My husband saw a change in myself, and I just knew I needed something. So when I went to my OBGYN, I mentioned it, and she pretty much knew that, yeah, from what I was experiencing, it was PMDD, because the time I was experiencing this emotional roller coaster was the week or two before my period, which every month, it was about the same time. So I was like, this must be PMDD as well. But she prescribed me a medication, Prozac, which is a typical, medication they prescribe. But what I didn't know, which I wish I knew at this time, was that there's other approaches too. It's not just medication. There's holistic, supplements and everything as well. So I wish I had known that, because I could have, even tried that before. But honestly, the medication she prescribed was a life changer, because it helped me and, navigate this. So I really want to educate people, because the patients I deal with, they don't even know what PMDD is. They're Googling, they're YouTubing, like, what is severe PMS? And they've come upon PMDD, and a lot of people don't even know what it is. So I want to raise awareness to that.
I want to ask you that. So I think you just brought up exactly what my next question was, which is, what does PMDD stand for, and how is it different than just PMS? So PMS, we know, is premenstrual syndrome.
Yeah.
And so what does PMDD stand for, and what's the difference between the two?
Yeah. So PMS is just your, normal premenstrual syndrome, but the PMDD is premenstrual dysphoric disorder. So it's an extreme form. It's not just your typical symptoms. It can be mild, moderate, or severe. Luckily for me, mine was only mild, but the clients I work with, it can be as extreme as severe, being that they are thinking about taking their lives. So
Mm.
that was something that was very, I want to help these. Like I can actually save a life if I can, educate these patients. But really, what PMDD is, it's a hormone-based mood disorder. So, yeah, it's the way that it's an abnormal brain reaction to normal reactions to hormones.
Okay.
So, yes. So a lot of people just think it might be hormonal, but really it's just the fluctuations in the hormones that causes the brain not to register with it. So it's just how their body responds to it.
Great. That's exactly what I was going to say too, is it's the response to your body's
Mhm.
hormones. It's not the natural response. It's actually more severe is what you're
Yeah.
telling me. So one of the takeaways that I just heard is you're a pharmacist and you were using medications for it, which it did help, which is
Mhm.
amazing. And so I always like to bring that up of, we are pharmacists, so we know that there is a need for medications at certain times. And when it's necessary, it's necessary.
Yeah.
But what I loved also hearing is that there are these alternative options, holistic options, natural options, supplements,
Mhm.
different forms of helping take care of your body and yourself and your hormones and just body regulation. And then you also talked about the hormones that we have. So I'd love for you to talk a little bit about how do you understand where a patient that you see is at the beginning, and then how do you just generally try to start to help them in these ways?
Yeah, first, what I do is just pretty much see if they're on any medication, to see where they want to be at. Because a lot of times, whenever they visit their doctor, they are prescribed something they don't even want to take. Like they don't know much about it. They put a band aid over it, say, oh, just get some birth control. That should help with it. But
Mm.
some people don't want that and are scared of the side effects. So I like to see like where they're at. Are they more wanting to see if a prescription would help or even both, whole, supplements along with lifestyle changes. So I just want to see where they're at of what they want to, take to help with the symptoms. And also, of course, I incorporate those lifestyle changes. But a lot of times they feel, misunderstood. They get dismissed a lot of times with their doctor. Sometimes the doctor don't even know much about it. And then they might say, you need to see a psychiatrist, and then they get diagnosed with maybe bipolar disorder, which I found in some patients that they get highly misdiagnosed for bipolar. And so they're, getting treated for something that they could have got treated differently in order to help their issue. I was lucky enough to have a prescriber that listened to me, but a lot of times, like, you have to wait months before your doctor's appointment. And then whenever you go there, you don't know really what to ask, what to say, and how to come across like what you're experiencing. So you want to utilize that time too to, make sure your answers are, you get your questions answered and your concerns because a lot of people don't even know where to start with that. And I want to help navigate and to help them know what to ask and where what they want for themselves for sure.
I love that. So you're taking all the words right out of my mouth, which is so fantastic. Because I was just about to say the same thing. I think one of the benefits that I know of of women working with you is you guiding them and supporting them on what to ask, where to go, what to do next, and having that support and accountability and guidance is just so important on this journey. And I do feel like in this age group that does so often get dismissed, that this is an important aspect to really dive into because it actually sets you up for success moving forward. I think a lot of us, those of us that are a little bit older than that, I'm going to say, have struggled, and now we're struggling even more as we've aged. And so I think there's a almost a prevention kind of method that we can work on here
Mhm.
if we get the right things in place, right? And so having somebody like you along on the journey is just so vitally important. So I'm really excited to know. And I mean, I have thoroughly enjoyed watching you and working with you to build this business with you, and watching what you're able to do and the impact that you're able to make. So super excited about that. Are there particular women that you see that are experiencing this more than others? Like, have you noticed any trends or anything that, um, is it more stress in their lives, or what, is there something that's going on that's kind of causing more PMDD?
Yeah, a commonality that I've seen is like it's not even those that are in their like early 20s. It might be after their first child or even their second child. It can present a lot of times even after having childbirth, which that was a big thing that a lot of people could relate to whenever it's how it started, when it started. And it affects not only their relationship. Like I've also found a lot of patients, it's like hindering their partnerships. Like they're not able to handle it because they don't understand and they don't know what to do for themselves. They don't know what to do to help. And also like with their kids are being very emotional and reactive, and they feel bad because it's out of their control.
Mhm.
And also even work life. I've seen a lot of people say that it's affecting their work life because people, you can't really say, can explain it. And some people might just think that, oh, you're just being over dramatic.
Mm.
But that's how they get, dismissed and not understood. And it's good whenever I see some of my patients, they are able to, confide in some of their, coworkers, and they understand, which I'm, thankful for them. But a lot of times it can, get their job, affect that to where they even get, fired.
Wow. Yeah. I mean, that's some important information right there, because I think, just listening to you is we almost need to learn about it ourselves and
Hmm.
understand it before we can even explain it to anybody else. And I feel like when you start talking about hormones and all of the things, it becomes a little taboo. People feel a little, they kind of get into their shells a little bit when it comes to talking about it. And so it's really hard. So I love that you're opening up this conversation for women. And when you talk about, after having the first child, a lot of us say, there's postpartum depression and all of
Yeah.
these things. And so we automatically go to a mental health illness or disorder, which sometimes it may or may not be. And I think this is
Mhm.
a really important, maybe even first step for women to take post first child, or even pre-child, if you're
Mhm.
experiencing any of these symptoms that Dr. Ashley's mentioned, to just have that first conversation. So I'm really excited to really bring this out into the world more, because it's an important conversation. I think, again, like I said, things become taboo, or we just don't talk about them enough. And so I'm so excited to have you on here to talk about this and really share this out into the world. So we could talk forever, and I would love to have you back on the podcast to maybe dive a little deeper into what PMDD is and some of those more in-depth symptoms and things like that. So we'll have another episode for that. But I wanted to really share with patients that this is an option, to look at other ways to help yourself to discover what's going on with you, not feel dismissed, to feel heard. And so I want you guys to contact Dr. Ashley Fornes with LAF Women's Wellness. LAF stands for Leading Advocacy for Women's Wellness. And really excited. We will have her information in the show notes, but her website is laughwomenswellness.com. And with that, Dr. Ashley, I always have my guests just end off with one big takeaway that they want patients to hear. So I'd love
Yes.
to hear that.
I definitely don't suffer in silence. A lot of people just suffer in silence not to get the help. I want to raise awareness. I want to promote early diagnosis because that's the key. There's no one answer for everybody. Everybody is so different in their symptoms, and a lot of people like to compare themselves to others and what they're using, but it's so individualized. So I mainly just want to raise awareness and to promote, don't suffer in silence. I can help.
This was so wonderful. Cannot wait to hear more from you in the future. Thank you again.
Thank you, Dr. Asha.